Hello, everybody, and welcome to another session of dental shadowing. Today we have Dr. Lee with us, who is an orthodontist, and she's going to show us some cool cases as well as tell us about her dental journey. So, Dr. Lee, you can take it away.
Thank you so much. Thanks for inviting me today to talk a little bit more about orthodontics and what I do. And at the end, we're going to have a Q&A. So if you guys have any questions during my presentation, please don't hesitate to ask. So my name is Jena Lee. I was born and raised in Nashville, Tennessee. I'm a Korean American, and I speak both Korean and English. Like I said, I'm an orthodontist, and I actually just graduated in February, and I just started working this month. So I'm excited to kind of share that journey with you all as we go through the presentation. Some of my hobbies include reading, cooking, yoga, and one thing I really learned through dental school and residency is the need to kind of self-care and decompress. So I think it's really important to keep up with your hobbies, and these are some of the things that help me kind of cope with stress and kind of take care of my mental health and myself. I currently live in Colorado with my husband, Tony, who is a general dentist actually, and my pup, Louie. He's here in my lap, so I'm sure you'll see him at some point during the presentation. So I completed my undergraduate studies at Vanderbilt University, which is located in Nashville, Tennessee. I was born and raised there, went to college there, and my first time outside of Nashville actually was when I went to Boston to get my master's degree and go to dental school. But going back to Vandy, I graduated in 2013 with my Bachelor of Arts in Cellular and Molecular Biology. I always had an interest in biology ever since high school, but it also checked off a lot of the prereqs that were required to go to dental school. So it was kind of killing two birds with one stone. I then went to get my master's degree at BU for 1 year. I got my master in oral health sciences and graduated in 2014. I did this to kind of help boost my credentials and have something to add to my resume before I applied to dental school. And I'll talk a little bit more about that when I talk about my career pathway. I then got accepted to BU for dental school, which is 4 years. I went there from 2014 to 2018, and I graduated with my DMD, or Doctor of Dental Medicine. And while I was in dental school, I got really interested in the field of orthodontics. I had always had an interest in orthodontics. I had braces as a kid, but through dental school, I really developed an affinity towards the field. So I decided to apply to orthodontic residency. I kind of applied all over the country, but I really, really liked University of Colorado when I came to interview here because the state is so beautiful. It was kind of chill vibes. You get skiing, you get the hiking, you get a lot of nature, and my husband really loved it as well. So we moved to Denver, Colorado in 2018. I went to a residency that was 2.5 years long, and I just recently graduated a couple months ago. So why did I pursue dentistry? I knew I wanted to do something in the healthcare profession, starting when I was in high school. I got to college and I didn't really know which direction I wanted to go. I didn't know if I wanted to go to med school, pharmacy school, and I had a really close family friend who was actually studying for the DAT at the time. So I got a little bit interested when she was, studying for that. Started asking her some questions, and she said, "Hey, why don't you just start shadowing a dentist and see if you like it?" So I started shadowing a few general dentists, and I really enjoyed the aspect of dentists being able to connect with their patients. General dentists see their patients pretty regularly on a 6-month hygiene schedule. So you kind of see them catching up with their patients, asking about their life and work and their children, how they're doing. And I really enjoyed that personal aspect that they were able to establish those relationships. I also loved the fact that dentists are able to be their own boss and run a business and run your own practice. I thought that was really unique and interesting, and something that I was kind of intrigued by, because I think being able to do dentistry is great, but also being able to run a business and run an office is really fun and also challenging, but it kind of breaks up the monotony of, just being a healthcare provider and being able to do this business side of it. I also love that dentistry has a lot to do with artistry and creativity and using your hands to do a lot of different things that require manual dexterity. So, as a dentist, you are constantly using your hands to create something that's beautiful, and you have to have an eye for aesthetics and making sure that the smile you're creating for your patients are matched to their face. Not every face is the same. Everyone's teeth look different. They have different shapes and sizes. So you have to use your creativity and artistic skills to create a smile design that's tailored to your patient. During dental school, like I said, I was able to kind of explore all the different facets of dentistry. There's general dentistry, there's endodontics who special in root canals, there's periodontists who are gum health specialists, there's oral surgery, there's pediatrics, there's prosthodontics, which is a more specialized form of general dentistry. They do like full mouth reconstructions and rehabilitations. And I really loved orthodontics because of a lot of different reasons. First of all, I saw how rewarding of a profession it was. Like I mentioned, I had braces as a kid growing up, and personally, I was so affected by the results of braces, and creating a beautiful smile really had an impact on my own life. And being able to see that in the patients who received orthodontics, I saw how rewarding it was. I loved making a positive impact on the patients. And this is actually a patient of mine in residency who I treated. She was one of my best patients. And at the end of her treatment, when I took her braces off, she told me she was really interested in dentistry. And she asked if she could, have my contact info, if she had any questions in terms of applying and all of that. And that was probably one of the most rewarding, positive experiences I got to experience firsthand as a provider to this day. So I love that aspect of being able to have a positive impact on people that you treat. Relatively speaking, I think it's a relatively stress-free career, especially compared to some of the other specialties of dentistry, because I think a lot of dentists get a bad rap. Patients come in, they're like, I hate being here. I hate seeing the dentist. You guys always hurt my teeth and I don't want to be here. And I think I heard that a lot as a dental student when I treated my patients. My husband, who's a general dentist, also, says that he's not the most favorite person that his patients see. But I think as an orthodontist, it's a little bit of a different dynamic because people who come to see you are there usually because they want to get straight teeth and they want to be there and they want to see you. So seeing that more happier patient population really has an effect on stress levels, I think. And generally speaking, I think orthodontics is a really positive, happy, stress-free career. Obviously, every career comes with its challenges and there is going to be stress involved, but on a general scale, I think it's a very happy profession. I also love that you have the ability to set your own hours. It's a very flexible work schedule, especially for people who want to have a family life. I think orthodontics and in general, the field of dentistry is a great field. I love that orthodontics is like solving a puzzle. Every case is very different. Everyone's smile and face and their jaw structure is different. So obviously you start developing patterns when you have been practicing for a while, but you still have to, pull different tools out of your toolbox to be able to create a treatment plan that's tailored best for your patient. So I love that you're constantly utilizing your brain and your skills and always sharpening them and always learning things, even when you've been practicing for 20, 30, 40 years. Like I mentioned, I love the ability to develop a relationship with the patients that you see. Orthodontics, you're seeing them monthly for the course of their treatment, whether that's 1 or 2 years. And seeing somebody regularly like that, it's inevitable that you're going to be able to develop those relationships. I think my favorite people to treat are my young adolescents and middle school kids. Just hearing about their like daily life and what they're going through at that stage of life really reminds me of what I was like back in that age. And it's a really interesting dynamic hearing what they're going through and developing that kind of relationship with them. You can really see at a certain point when patients start to trust you and when they start liking you, and kind of earning that trust is really special and really exciting for me, at least. I love that orthodontics too, you get to treat a variety of patients of all ages. You can see kids as young as like 5, 6, 7 years old, all the way to 60, 70-year-old patients these days who still want to achieve straight teeth. And it's never too late to want to get a beautiful smile and have an impact on your self esteem and confidence. So I love that you're able to treat such a wide variety of people. So, a little bit about my own pathway of how I got here. Step one is taking those prereqs prior to dental school. Like I said, I kind of knocked it out with my major. I was a biology major. I also made sure to shadow different dentists to make sure this is really what I wanted to do and to also create relationships so that they may be able to write me a letter of recommendation and all of those things. I applied to a master's program to kind of boost my resume and credentials, like I said, because truthfully speaking, my first and second years of college, I didn't make the grades that I really wanted to and that I had heard are needed to apply to dental school. Coming from high school to college is a huge transition, and learning how to study while balancing your social life and you're taking, difficult courses that are, scientific courses. And it took me a while to kind of get into the groove of things and to figure out what best worked for me. And I think I was a little bit discouraged in the beginning of college because, I wasn't making those great grades and the great GPA that everyone always told me about. And I was very afraid, like, is it too late for me to kind of go down this path? But luckily I was able to meet some people who had similar situations, and there's always a way to pursue your dreams and your passions. So don't just get discouraged. And, even if it's not a traditional route where you go from college to dental school to residency, and maybe you take a year off here to work or go to a master's program, there's multiple pathways to get to where you want to be. So whatever that pathway may be for you, don't get discouraged and kind of keep the course and you'll get there. So for me, that was applying to a master's program. My husband actually I met my husband in undergrad and we both applied to the master's program, which also was really great for us because that gave us the ability to have a higher chance of getting accepted into the same dental school, because the master's program kind of gives you connections with the admission staff and getting to know all the people, and it gives you a little bit of a boost, I guess, to get into BU dental school. So it really helped my husband and I be able to go to the same dental school, which was really great. I got accepted into BU after a year of the master's program, went there for 4 years, got involved with ortho research to help, add to my resume when I was going to apply to residencies. And then I applied to residencies kind of all over the country. I accepted my position here in Colorado for 2.5 years. I went here where then I started applying for jobs in associateship positions. I eventually knew I wanted to own my own practice, but starting off, I wanted to get, my skills as an orthodontist under my belt and feel a lot more confident before I ran my own practice. So I applied to a few different positions and accepted a associate position at corporate office. So I actually started at the beginning of this month. I've only been working for a short while, so it's all still very new to me, but it's very exciting that I'm finally here and I'm finally have reached my goal of being an orthodontist. So it's been a very long but exciting journey. So, a little bit about pre dental school, some of the things that you may be thinking about if you're interested in dental school. Prereqs are important. So, you have to take your basic science courses, whether that means you major in something that helps you get there. Although I do think it is really interesting. I've met a lot of people who majored in English or history or things that they're really passionate about. And I think I stand by that in pursuing your passions and, doing what makes you happy, because I think overall that makes you a really well rounded candidate. So, you know, being able to major in English while also tackling the prereqs makes you really well rounded and kind of a go getter and something that is really interesting in your application and that you can talk about when you're applying. So, I wouldn't say abandon your passions to just do science things. And, I think you need to pursue what you are interested in most. You only get 4 years of undergrad, so make the most of it. I think shadowing is really, really important because not only do you add that to your resume, you also see what it is like in a daily life as a dentist. And if you can really see yourself doing this for the rest of your life and your career, the best way to see that is to watch somebody do it. So shadowing is really important, and you're able to receive letters of recommendation, which are really important in the application process. I think volunteer work is really important too, not only to add to your resume once again, but being able to kind of create that ability to have empathy for people, because as a healthcare professional, you have to have empathy for the patients you treat. And you have to be able to connect with them on a personal level. And being able to volunteer is a great way to kind of develop that skill and see, a lot of people who are out there who are less fortunate than you are. And it really kind of grounds you and brings you back to reality and why you want to pursue a healthcare profession in the first place. Pursuing a leadership role can be really, positive to your resume. I wrote this as a note to myself for some of the leadership roles I did. We had this club called volunteer students for Vanderbilt students volunteer for science. And basically we would go to elementary schools and kind of work in groups and bring them like fun science experiments that they could do. And so I kind of was able to be a leader in my small group. I also served as a mentor in a group called Strive, where we went to underserved communities, specifically high schools, where the high school students wanted to go to college, but they didn't have the guidance that they needed to do that. So we served as mentors, sort of, to help, whether that was helping them with their homework or even going through the application process to go to college. So that was a really a cool thing that I was involved in that I was able to talk about in my interviews. I think having hobbies while being a good student helps you, once again, be a well-rounded candidate. And I think it kind of sets you apart from everybody else. For me, my hobbies back then included music. I had grown up playing piano, violin, choir, dance. So, in my free time, I had music and I had a little recording setup that I recorded music whenever I had time. And that was something that was unique about me that I was able to talk about with admission staff. And I had quite a few people bring that up out of my resume to talk about it. And I think that helps you kind of stand out from other candidates, is what makes you different that you can talk about and makes you unique. Obviously, you have to be preparing for the DAT during this pre-dental school phase. I personally took a Kaplan course and read through the Kaplan book. And then I believe there was a program called Crack the DAT. It feels like forever ago, so I can't really remember exactly what all I used. But having those resources, I think the Kaplan course was a great way to kind of dive into it and get introduced to the DAT, and then just being diligent about preparing for that, because it is a more difficult exam. You do have to put in time to study for it. And then for me, like I said, I did a 1 year's master's program before dental school that helped me get to where I wanted to be. I chose to go to BU. It just kind of happened naturally because my husband and I both got interviews there after our master's program, and it was important for us to be able to go to the same program. So we chose to stay at BU. Best part of dental school is the meeting friends and meeting people who are kind of interested in the same field as you are. In college, you have friends from all different backgrounds and groups, and you have friends who are going to finance or English majors or who want to be teachers and med school. But finally being in a place where everyone's kind of in the same mindset as you, it can be challenging on the one hand because there's a lot of competition, and there's a lot of kind of clashing in that way, which is kind of interesting. But in another aspect, you're able to talk about like these things that you're passionate about and interested in and your future career goals with people who have the same goals as you. And I think that's really exciting. And some of my most close friends to this day are people that I met in dental school. We still talk about dentistry, which I'm not able to do with a lot of my close college friends. Worst part, I'm not going to lie, I'm not going to sugarcoat it. Dental school is very grueling for 4 years. There's a lot of self-doubt that I went through, a lot of times, and I was like, why did I end up doing this? Why did I do this? And it all comes down to, like I said, you have to shadow and make sure this is really what you want to do before you go into dental school, because it is a challenging 4 years and you are going to have moments where you kind of doubt yourself or kind of maybe wish you didn't do this. But if it's really truly something that you're passionate about, you're going to be able to work through all that. And at the end of the day, when you finally achieve your goal, you're going to be so happy that you did. Also, dental school is a very steep learning curve because you are learning how to work your hands in a tiny little space, drilling and filling teeth. And it's a very dexterous, manual dexterity is a very important part. And not everybody is blessed with being able to use their hands in that way. I think I'd say most people are not used to being able to do those things. So there is a bit of a learning curve. You have to spend a lot of time in the lab. And for me personally, I had very little time to kind of pursue the hobbies that I loved outside of dental school. And that's when I realized, like coming out of dental school, I finally realized like how important it is to still do the things that you love, because otherwise you're going to be miserable. So you are going to have very little time to do other things, but I think it's important to make time to do those things because that's what helps you de-stress and helps you kind of relax at the end of the day. So, that's kind of my spiel of what I experienced in dental school, but I think, it's very important. And looking back, I was able to do a little bit more of that in residency, and overall, I was so much happier doing that and happier in residency that way. So tips for dental school: try to stay ahead of your classes and your exam schedule. You're going to have multiple exams probably in a week. And if you're kind of last minute cramming, it's going to be hard. I know some people work differently and they're able to do that. So, everyone's different. But I think as much as you are able to stay on top of your classes, it's going to help you in the long run. Practice makes perfect, but don't burn yourself out. I remember I was in the lab for hours and hours and hours because I was so frustrated. And I think everyone who goes to dental school is a little bit of a perfectionist. So when I was doing these horrible preps, I was so embarrassed of myself and, really down on myself. But, everybody gets there, and you're going to be doing this for a long time. So don't be too hard on yourself. Don't burn yourself out. Still do the things you love, like I said. Dental school D1 and D2 year are basically years that you're going to be doing your basic science courses, and you're going to be going into lab for the first time and improving your hand skills. These are some of the courses we took. There's way more, but some of the basic science courses we took. And then this is when you're starting to work on mannequins and learning how to drill a tooth, how to prep a crown, how to make a denture. And then we also, I think this is unique to BU, we had what's called Apex for 8 weeks between D1 and D2 year during the summer, where we went and shadowed a dentist. And, shadowing in undergrad is a little bit different than shadowing in dental school because you know a little bit more about what they're doing. So I think you gain more clinical experience that way. But either way, it was still an interesting time. I think D3 and D4 year are the years that it gets real, and either you love it or you hate it. I had a love-hate relationship with it, but you're learning more about everything dentistry. So all the different specialties in dentistry. You begin treating your own patients, which is very, very scary for me, at least the first time, I saw my first patient. And I remember my patient asked me, like, how many times have you done this? And I was like, oh, I've done it a handful of times. I didn't tell him it was on a mannequin, but you got to make sure they have trust in you. So you kind of had to fake it till you make it. But you start to see patients, and not only are you trying to keep up with your hand skills, but you're learning how to have a patient doctor relationship. And I think that's also a very important learning experience, because you're not going to be a natural right off the bat, conversing with patients, and you're going to slip up and you're going to sound nervous, and it's all a part of the learning experience. And then at BU, we actually had a 3-month externship during our 4th year. I worked at a community health center in Boston. We had people go to Florida, Hawaii, kind of all over the country, which is really cool. But my husband and I chose to stay in Boston because we had just gotten our dog. So it was 3 months of doing dentistry on patients. And this is where I really picked up on my speed and being able to treat at a very fast pace, because in dental school, they give you 3 hours to do one filling. And that's just not realistic in the real world. You probably have more like 10 to 20 minutes, maybe 5. So learning how to do that at a quick pace was really important. And I think the 3-month externship was really important for that. After dental school, I went to orthodontic residency again. Year 1 and 2, so it's a 2.5-year program. And years 1 and 2, you're learning a lot of didactics again. That is very kind of textbook focused on the orthodontic side of things. You're learning about biomechanics, growth and development, diagnosis and treatment planning. And for our program, in order to get our master's, we had to do a research project as well. We also start treating patients right off the bat in year 1, unlike dental school. And it's a lot less daunting because you're used to seeing patients by now from dental school. So I was like, I got this under the bag. I don't feel nervous in terms of relating to patients and all of that, but it is a whole different ball game. I think orthodontics is like a whole new language compared to dentistry. So kind of relearning all of that was, another learning curve. But you're finally doing what you're really interested in. And I was way more interested in orthodontics than general dentistry. So I had a lot of fun in my residency. We started 45 of our own cases. And it's interesting because on average, orthodontic treatment is about 1.5 years to 2 years. So you don't necessarily get to finish a lot of the cases that you start, since, you only have 2.5 years in residency, but you also get a lot of transfer cases from residents who didn't finish their own cases graduating. So you get a wide variety of cases that you get to see and treat. And then, like I said, I had to do a research project, which my research was on forensics, which was really cool. We had to learn, a lot of people identify, or forensic odontologists or forensic dentists identify bodies and, remains, which sounds very morbid, but on developing or based on their age. And we had to see, does braces kind of affect dental age, because no one had really done research on that. So that was a really cool experience. And I think it might be published hopefully sometime in the future. So going into orthodontics, what is orthodontics? I kind of stole this from Wikipedia, but I thought it had a very good general overview of what orthodontics is. And it's a specialty of dentistry that deals with the diagnosis, prevention, and correction of malaligned teeth and jaws and bite patterns. It can also focus on modifying facial growth, which is really cool. If you see patients at a certain age before they finish growing, you're actually able to influence heavily how their jaws grow. So we don't just focus on teeth, which I think a lot of people have this misconception of orthodontics is just about straightening teeth. We actually do a lot in terms of your facial structure, how your jaws look and function, how your jaw joint is positioned, the health of your bite, and all of that. So it's not just about straightening teeth, although that's a huge part of it. There's a lot more that's involved in terms of just the health of your teeth and the health of your bite. Why is it important? I think being able to improve someone's self-esteem and confidence is a really important part of orthodontics. I think as a young kid, even, we learn in residency that, there's a very important part in treating young kids because of the way they can develop mentally and psychosocially. Kids can be mean sometimes and get bullied for maybe having like flared teeth or having a huge gap. And, you would think that it's not a big deal. Kids get over it as they get older, but it actually has been proven that it affects their mental health and the way they perform in school. So it's really important to take that into consideration. Orthodontics is really important also in maintaining your dental and gum health. If teeth are super crowded out and you can't keep your teeth clean, you can cause gum problems, bone can recede, you can have gum issues and gum recession and things like that. Also, if teeth are in a crooked position, it can have an effect on your bone health, and long term, it can cause poor bites where it can cause like problems in your jaw joint and things like that. So not just for confidence issues, but also from a health standpoint, it's really important. You can correct jaw discrepancies. Like I said, if you catch them at an early age, you can modify how much their jaw grows, or you can restrict jaw growth if you need to. If you catch them at a late age where they've finished developing, you may have to work with a surgeon, like an orthodontic surgeon, where they actually do jaw surgery in order to correct their jaws, and then finish off with braces to fix the bite. And I actually have a case that's a surgical case that I can show you. But some people may have like a class 3 relationship where they have really big jaws and they have an underbite that can only be fixed with surgery and braces. Or they might have like too small of a jaw where it almost looks like they don't have a chin, and they're very self-conscious about how they look. And we can actually affect that with either growth or surgery. So it's really cool that we're able to affect people in those ways. If we don't catch them early enough in phase 1, we can actually cause poor growth patterns. So if we have a kid coming in at age 7 and they have like a crossbite, and we don't fix it at that early age during what we call a phase 1 treatment, that can actually develop into a skeletal issue, and they may have a canted jaw or asymmetric jaw that keeps growing as they get older. So it's really important to catch these problems early on. And then, like I said, correction of habits is interesting. We have a lot of patients come in, even patients who are older, who admit that they have like a thumb sucking habit or some kind of like tongue thrust habit. And that can actually affect the way your teeth line up. Like if you are used to sucking your thumb, you'll have an anterior open bite, you'll have a narrower upper jaw where you have a cross bite. And so orthodontics is a lot about being able to break those habits and then fixing the issues that those habits have caused. Some common procedures that you see in orthodontics: diagnosis and treatment planning. This is probably the most important step in any case, is being able to treatment plan a really good plan from the beginning. It's like with anything in life, the more you plan for in the beginning, the easier and better it's going to turn out. So when you have a patient in the chair and the more time you spend treatment planning your patient and coming up with a good plan for them, you're going to have a more efficient plan, a better outcome, an easier treatment for your patient. You have consults where you talk about these treatment plans with the patient. And this is the important part of answering their questions, earning their trust, giving them their different options, and kind of laying it all out there so that they are not surprised mid-treatment. You have initial bondings. This is where you obviously place the brackets, appliances, attachments, whatever it may be. Invisalign is becoming huge, as you guys probably know. And Invisalign is another type of way to move teeth. And rather than having those metal brackets, we are now able to kind of bond tooth colored attachments where the Invisalign trays grab onto. And each tray has programmed into it like 0.25 millimeters of movement. And that's how the teeth move. People think Invisalign is truly invisible, but you have to, tell your patients, no, we're going to have to bond these little attachments on. They are going to be tooth colored, but you are going to have something on your teeth so that they're not surprised when they come in and you're bonding all this stuff and they're under the impression that, it's going to be invisible. We see a lot of patients for SOS appointments where a lot of kids have broken brackets because they've been chewing on things they shouldn't be, or they have pokey wires that you have to clip for them. Reties are the monthly evals you see them for to track progress. Debonds are the most important day for your patients, the most exciting day where they get to get their braces off. And then recalls are periodic examinations, like every 4 to 6 months for kids who are not yet ready, but you're able to kind of monitor them for when they're ready to get treatment. So my typical day, 8 to 5 day, like I said, I only have been working for a few days, so I'm still very new to this, but it's very different than residency because now you're in charge of leading a team and training staff and assistants. So we start the day off with the morning huddle. This is where you talk about your cases for the day. You tell your assistants, here's what we want to work on today. And every office is a little different. From what I've seen from shadowing, a lot of offices use this time to kind of give a little motivational speech and kind of get everyone ready for the day. So we'll see how that goes for me when I start, seeing my staff in the mornings. You also have to make sure all your cases are in that day, so you don't have patients coming in when their case is not there yet, because that's not a great practice builder. So making sure you're ready for the day, making sure all your Invisalign cases are there, your retainers, your appliances, and all of that. And then you see patients. So in residency, you're seeing one patient at a time and you're doing all the work. In the working world, you have assistants that you've trained to do most of the work, but you are running like several columns. So you're jumping from room to room, making sure that the work that the assistants are doing is good. And, you check everything that they're doing, but you physically can't be seeing multiple patients all at once. So you have to be able to have really good staff to do those things for you so that you can kind of jump around and see multiple patients at a time. I get a 1-hour lunch break from 12 to 1, and usually I'm doing like clin checks during this time for Invisalign. I'm running through notes, I'm catching up on notes from the morning. And then if I have a, time, maybe I'll, do something for my own self. But usually I'm still new, so I'm still catching up on things and making sure I'm on top of things. When I have time, I think training assistants is going to be really important because every orthodontist has a little different way of doing things. So the previous orthodontist may have done something a little differently than I have. So I'll have to find some time to train them. Managing inventory of items that need to be reordered is part of my day now. And then if we have done debonds in the morning, we got to fabricate those retainers during the day so that they can come pick them up later on in the day. So these are the different types of braces now that we have. We've got the traditional metal brackets with the colors. We've got self-ligating brackets. These actually have doors that open and close, so you don't have those colored rings around them anymore. We've got Invisalign, where you've got these clear trays. These are actually lingual braces that go on the back of your teeth. So a lot of patients who are older, especially, and they have jobs where they talk a lot or give a lot of presentations, they want this more aesthetic option of having the braces on the back of their teeth. Not everyone is a candidate for Invisalign and lingual. It has to be a certain type of case because it is a little bit more, it's a little bit more difficult to control, but it's a really cool way to still be aesthetic while having braces for especially older patients. And then you've got clear braces here that a lot of teens like to have because they want the clear and less visible braces. So diving into some cases, this is a phase 1 case, and she was so cute. She came in with like these big bows every day, and she came in because she had this crossbite. You can see crossbite in the front. We call this an anterior crossbite, and then we've got a posterior crossbite here. And she had this because her narrow upper jaw just wasn't the size that it should be. If you think about teeth, you have to have top teeth fit over the bottom teeth. So you need more tooth mass on top because if you think of like a shoebox and a lid, the lid has to fit over the box. Well, in her case, her upper jaw just wasn't big enough to fit over her lower jaw. So we had to expand with an expander and then give her some braces up here to kind of straighten those rotations out. And then we told her eventually she's going to need round 2 of braces. So our goals for phase 1 are really just to expand your upper jaw and align those front 4 teeth and then call it good. So this is mid-treatment. You can see here this Hyrax expander. It has a screw in the middle that the mom turns every night, and every night it opens up a little bit more. And then these bars on the side will push those teeth out. The way that you can tell that expansion is working truly is they form a little gap here, and normally the gap, if it really works, they're going to have a whopping gap between their teeth, and you got to, assure them that we're going to close that space. But we were able to get her expanded enough where, she was no longer in that anterior crossbite. She didn't have a posterior crossbite. And like I said, she's going to have to come back for round 2 where we address this little peg lateral she has here where her lateral is really small. She's probably going to have a little bit of crowding that we're going to have to resolve and kind of fix things up and fine tune things. But we were able to get her out of those crossbites, which were the main concern. This is case number 2. It's an Invisalign case. And this is really cool because the patient came in wanting an aesthetic option of treatment. She talks a lot and gives a lot of presentations at her job. So she didn't want the metal braces. And she really didn't like this openness she had here with her lateral incisors. And she also didn't like this crowding she had. So we were able to give her Invisalign. This was mid-treatment. Oftentimes with Invisalign, we have to do a refinement in the middle of treatment where we have to treatment plan the case and get a new set of aligners. So at this point, you can see we still have this open bite to close. And a lot of times when you're unraveling crowding on the bottom, they kind of flare those teeth out a little bit. And in order to close that bite, we got to, bring those teeth back. So that's what we did. And here you can see her open bite's a lot better. Her crowding's resolved. I think we could have closed this bite down a little bit more, but by then patient was not wanting to go through a second round. So she's like, I'm really happy with this. I'm ready to get them off. And so she was really happy with her smile. And I think it was a good result. Case 3 is an extraction case that I thought I would show because a lot of people are actually surprised that orthodontists want to take out teeth in order to treat their case, and they're really confused and worried. They're like, well, if you're going to take out teeth, like, am I going to have spaces there? Like, what's going to go on? And we have to tell them, no, we're going to take out teeth because we need to use that space in order to fix your problems. So in this case, the patient had super flared front teeth on bottom and top. You can see because of that, she had sort of these protruded lips and this mentalis strain here on the chin. You can see that she was kind of straining her chin to close her mouth over her flared teeth, and that's why you can kind of see this strain here. She also had an open bite here. So because of all those reasons, we told her if we don't take out any teeth, we're not going to be able to bring those front teeth back. Right now they're too protruded out. We need space to close that. We also need space to be able to close this open bite, and we need to be able to bring all those teeth back and close that so that you can have a nice relaxed, relaxed lips when you're closing, and that you don't want this strain here. So patient agreed to extractions. We took out 4 teeth. We took out, let's see, you each have 4 premolars or bicuspids on top and 4 premolars and bicuspids on the bottom. So we took 2 out on top, 2 out on bottom. You can see here we are using that space to bring these teeth back. She still has that chin strain here, that mentalis strain, but things are coming together really nicely. That open bite is gone. And then at the finish, you can see her upper and lower incisors are at a really good angle now. They're no longer flared out. She has no more strain in that chin. She's able to relax and close her lips really nicely. She doesn't have that open bite anymore. All her crowding's resolved. She's got a really nice smile arc that follows her lower lip. And so I think it was a really successful treatment, and extractions were a really good call for her case. And lastly, I wanted to show a surgical case. This patient came in because he had an anterior open bite. He's got a posterior crossbite, and he came in at too old of an age where he was kind of done growing, and we weren't able to just expand his teeth and fix this just orthodontically. You can also see here, we call this a lateral cephalogram. It's a X-ray of a snapshot of the side of your face. And we get a lot of information from just the snapshot. You can see how much growth is left in a patient just by looking at their vertebrae. You can see how big their upper and lower jaws are, where they are in relation to each other. You can see the position of their teeth. So every orthodontist really needs this tool in order to diagnose and see what's going on. So in this case, he's got a lower jaw that's way too big for his upper jaw. It's too long. It's too steep in, going down at an angle like that. He's got that anterior open bite. He's done growing, so we can't really do much for him just orthopedically. We're going to need to get surgery involved. And luckily, his insurance covered his surgery, so we were able to go through with that. So this was pre-surgery, and we have to warn patients a lot of the times when we set you up for surgery, your bite's going to get worse before it gets better. So he's got that open bite that's a little bit worse than where he started. You can see here, like his lower jaw is a little bit too in front of his upper jaw. So if he were to close down that bite, he'd have that underbite. So we needed to have surgery for him to bring that lower jaw back. So this was a double jaw case where we had to bring the lower jaw back, and you can see here it's now in a good position with the upper jaw. We also had to have an upper jaw surgery where we had to kind of segmentalize the upper jaw and widen it, and also bring that front segment down in order to fix the transverse issue in that anterior open bite. So now you can see here his posterior crossbite's gotten a lot better. I think it could have been a little bit more expanded, but patient was super happy. He doesn't have that open anterior bite anymore. He's able to bite into a sandwich and a piece of lettuce, which he couldn't do before. And he was really happy with his smile. It's really interesting. You can see these screws that the surgeons placed in order to stabilize his jaws into those segments that they made. So those were my cases. I know it's kind of weird because I'm using all this terminology, but if you're interested, I have a lot of like ortho tidbits on my Instagram you can always check out. And if you were interested in dental school before this presentation, or maybe this presentation has piqued your interest in dental school, these are kind of my 3 pieces of advice. Obviously, there's so much I could talk about in terms of applying, but if I could boil it down to just 3 simple points, I would say explore your passions, gain shadowing experience, make sure this is really something you want to do, and explore all your different passions and things that you might want to do, because this is your future career, and you have to really make sure you can see yourself doing this long term. It's a grueling 4 years, like I said, so if you know that you're passionate about it, you're going to be able to make it out on the other side even through those tough 4 years. 2, diversify your resume. Be a well-rounded candidate, like I said. Make sure that you do make good grades, but that's not the end-all be-all. And don't be discouraged if you don't have like that perfect 4.0 GPA. I know plenty of people who are able to get to dental school and even specialize who weren't like number one in their class, and they did have some things that they struggle with. And I think that makes everybody human. As long as you're able to be honest about it, as long as you are a interesting, unique, well-rounded individual that you can talk about in your interviews, that's going to help. So choose something that makes you unique in your personal statements, something that's not the cookie cutter, like, oh, I, love, medicine for A, B, and C. I think if you're able to tie in something that's interesting to you, that'll help you stand out in the crowd. And then number 3, perseverance is like the most important thing. There are many times you may want to give up or kind of question yourself, but kind of push through, and it'll all be worth it in the end. So that was just kind of my advice. Hope you enjoyed the presentation. Like I said, I am available over Instagram or over email. If you guys have any questions, I would love to connect with all of you guys. So feel free to message me on there. And then if you guys have any questions, I'd love to answer them and kind of chat with you guys. So yeah.
Okay, awesome. So me and David have some questions. They're going to be from the chat as well. So the first question was, do you have any advice for dental students who are interested in ortho?
Yeah, I would say try to get involved in like some sort of ortho research if you can during dental school, and shadow some orthodontists too. I think getting good letters of recommendation is going to help you a lot. And then obviously making the good grades. But like I said, just making sure you diversify and do a lot of things that you can put on your resume will help you.
Yeah, and someone on the chat asked, when do you think is the best time to take the GRE and how to prepare for it?
So I took my GRE, I think summer or fall of my 4th year of dental school. It was like right before applications opened. So I started studying for the GRE probably like 3 months before that, which I probably could have started a little earlier. I hadn't done math like that in so long, so it was like, interesting thing to see again. But yeah, I think that's good. I think if you start preparing for the GRE, maybe like 4 to 6 months in advance, and then take it like right before applications open, I think that's a good time.
And then another question here was, do you have any networking advice with the COVID pandemic going on?
Oh man, I know it's been so hard. I think like these sessions are really great actually because they never were available when I was going through it. And also like Instagram has been really great. There's so many different types of healthcare providers, not just dentists, but lots of dentists and lots of orthodontists on there. I think if you follow their Instagram pages, they love connecting with people. And if you just genuinely have questions for them and connect with them in that way, slide into their DMs. I think that's a great way to network. So I would look into Instagram. I do know, like, I don't know with COVID regulations if offices are starting to open up a little bit more just with vaccinations and all of that going on. So I would call around and see, like, hey, are you okay with me coming in to shadow? Some offices may be okay with that. Some offices may not. So I don't think it hurts to ask.
And another question was, I know you touched about this, but when you doubted yourself or when there was obstacles, like how did you overcome and reconfirm your drive for dentistry?
Yeah. Honestly, to be quite honest, a lot of it too was like, well, I took out loans and it's a little bit too late to go back on that. So that was truthfully part of it. But another part was kind of remembering why I did this in the first place. Like for me, like connecting with my patients, I had some patients that were such a headache and I like dreaded seeing, but the patients that I really loved and I connected with made it all worth it. And just like seeing how ecstatic and grateful they were for the treatment you were giving them kind of brought it all back to me and made me realize like why I decided to do this in the first place was for that personal connection I could have with the patients. So kind of remind yourself, like, why did I choose to do this in the first place? And that's why I also said, like, make sure this is something you really want to do before you do it, because it is kind of hard to back out once you're in it. So yeah, that would be my piece of advice. It also helped because my husband was also in the same thing, so we could kind of vent together and also like reassure each other. Finding a good group of friends, a good network of people who's going to encourage you to help keep going and help each other is going to be important too.
And then as an orthodontist, are days repetitive or is it like a constant mix of things?
I do think like after a while it will get a little repetitive, but I don't think that's necessarily a bad thing. I think maybe not repetitive, but more like you are going to develop a pattern and be able to be more efficient in the things you do. But like I said, ortho is so unique in that like every case is a puzzle and every consult you go into, treatment plan that you do, you are going to constantly have to use your brain. So I don't think it's ever going to be like totally monotonous where you're on autopilot and you're not thinking. You're always going to be on your feet and have to think on your feet. So I think that's why I love ortho so much. And like the days may seem repetitive in terms of like your schedule and what you do, but in terms of using your brain and like being on your toes, that's never going to be like a monotonous thing.
Yeah, and another question was, I know in dental school they don't really talk about the business side of things. So do you recommend like minoring or taking business courses?
I mean, yeah, that's amazing if you have the time to do that. I think that'll be a tremendous asset to you. I know a fellow like colleague who's an orthodontist who's actually doing like business school now. And I think that's going to help her tremendously. I don't think if you don't do it, you're not going to be able to, have your own practice or anything like that. Because I know plenty of people who haven't gone to business school and they're still able to be successful. But if you have the time to do it, if you're passionate about it, if you're willing to, take out the loans and all of that to do that, I think you'll be way better for it. And yeah, I would definitely encourage you to do that if you can. But if you can't, also, it's not the end of the world.
And then another question here was, how early or late in dental school would you recommend someone deciding on specializing?
So I know people who like go in straight off the gate knowing they want to specialize in a certain thing. And then I know people who decide super late, like D4 year. I don't think there's a right or wrong. I will say, like, I would try to give like go in with an open mind. Like maybe you are interested in ortho or endo or oral surgery from D1, but don't be so closed-minded where you just are so tunnel vision that you don't give other things a try and a shot. Cause I think that can really hurt you in a lot of ways too. But I would say kind of have an idea of what you want to do by D3 year, just so you can start establishing that network and connection, being able to shadow someone, being able to establish a relationship who will be able to write you a letter of rec. So I think around like D3 year, have an idea of what you might want to do. But yeah, that would be my advice.
Would you say it was easier for you like in lab with the manual dexterity that you had because you did like piano and violin?
I think maybe a little bit, but it is just a whole different ball game. Like cutting teeth, especially mannequin teeth, is very different because you're like burning the heck out of this piece of plastic and you've never done something like that before. So it was still like a huge steep learning curve for me, but I think it did help that I was used to like working with my hands in a certain way. People that like worked as dental assistants or are like really into art. Like I know people who were really into art and like making sculptures and things like that. Like they tended to pick things up pretty quickly. So yeah, I'd say if you are used to like using your hands in a certain way, it's going to help you. It's never going to hurt you, but it's still so different that there is still going to be like a learning curve to doing it.
Then what do you think is the most important quality of an orthodontist?
Most important quality. I think as any healthcare professional, having the empathy and like truly caring about the patient you treat is the number one thing that's important, because as a healthcare provider, like you're there to do a service for somebody else who's coming in to seek your expertise. And I think a lot of people, once they get to this stage, it's hard to not to let it get to your head sometimes. I mean, you've accomplished a lot and you've gone through a lot of training to get there. But I think it's important to kind of like ground yourself and come back and remember why you did it in the first place. I think that's like the number one thing. I mean, I think there's a lot of things that you have to be for an orthodontist. I think being able to be a good leader is really important because, like I said, you have to train your assistants really well in order to run like a well-oiled machine and treat patients effectively. So being a good leader, being able to multitask, and then being like an empathetic provider, I think are important things as an orthodontist.
When did you know that like you wanted to do ortho? Like was it like childhood, high school?
So I think, before I went into dental school, I never thought like, oh, I want to be an orthodontist someday. But like, I always knew that ortho had a big impact on me. Like, I remember my parents used to tease me all the time because I had like terrible teeth before I had my braces. So like, it always had like it was a big chunk of my life. But then when I got into dental school, I was kind of reminded of that and reminded how much ortho actually did impact me. So I think wanting to be an orthodontist didn't really happen till I got into dental school, but having had that childhood experience did influence me. Like I said, though, I, kind of had an interest in ortho from D1, but I didn't really know what I wanted to do. I was also like unsure if I'd make it since I knew ortho was a competitive specialty. It's like one of the harder ones to get into. So, I wasn't sure if I'd be able to do that. So first and second year, I tried to keep an open mind. And then I think by third year, I realized like I really wanted to do that because I also didn't love general dentistry. I didn't love like the fillings and the crowns and the patients kind of being in pain when they saw you and like always making comments like, oh, I hate the dentist. Like, I think that kind of wore on me mentally. So I think that was another push for me to kind of go into orthodontics as well.
And then what advice would you give to someone who is entering a gap year after undergrad and working as a dental assistant during the gap year?
Oh my gosh, I think that's great. I know so many people who did that, and they had such a leg up from everybody else because they knew all the terminology, they knew all the materials, and they just were just more equipped. So I highly encourage that. Just make sure that maybe you like establish a good relationship for the dentist that you're working for so that they'll write you a good letter of rec. I think you can really use that in your application, whether it's your personal statement or on your resume, like really write about your experience as an assistant and what you took away from that. But yeah, I think that's a really great way to kind of dive into the field of dentistry. And if you're taking a gap year and you're able to work as a dental assistant, I think that would be really good. I also know like a lot of people who did that, the dentist they worked for kind of told them, well, I'm maybe looking to hire when you're done with dental school. And they established those relationships while they were working there. And so they had a place they were already, knew they would be employed when they were done with dental school. So it really helped them in that way too.
Okay, and then our last question for you is, what is your favorite procedure to perform?
Oh my gosh. So I guess now that I'm an orthodontist, I don't actually do a lot of the actual performing. I have a lot of the assistants that help me with that. But I think my favorite day is debond day because that's where you really feel the reward. Like when you take off all the braces and all the patients are like obsessed with their slimy teeth and they look in the mirror and they're so happy. Like I think both the patient and the doctor are so excited to have finally achieved this like goal together. And I think it's a really special experience. So I would say my favorite like procedure and day is definitely debond day. I think that's like when I get really excited and for what I do. And yeah.
All right, well, that is going to conclude our session. Thank you so much, Dr. Lee. If you have anything else to say, you can go ahead and say it right now.
Yeah, thank you guys so much for inviting me. I love doing these sessions because it's so like inspiring for me to seeing so many young, motivated people who are probably like way ahead of where I was when I was your age. So it's really encouraging to see. And thanks for including me. So yeah, I hope I get to connect with you guys again. And I'm always available to chat if you have any more questions.
All right, the post-session quiz link is in the chat for everybody. And yeah, that's going to conclude the session.